Hello friends, today we are going to learn very important topic related to dentistry and especially to the doctors or dentists who practices in own clinic or consultation. You should definitely learn or know these topics, that is medico legal aspects in dentistry. Myself Dr. Shubhankar Kumar Singh from Dr. Singh Academy. So come and now we learn medico legal aspects in dentistry. What all is there? So this comes medico legal means what are the difference definition and its importance. Medico legal means medical work plus legal. Don't both combine and together forms the medico legal. Means medical practice and law together. Today patients are more aware their rights and dentists must be equally aware of their rights and their legal responsibilities, because legal awareness is rising nowadays. So what are importance in medico legal aspects in dentistry or medico legal cases? It prevents litigation. A single mistakes or poor communication leads to legal trouble. This all medico legal area, it protects you, protects reputation, ensures safety also. So my dear friends, you should understand medico legal aspects protect both doctor and the patient. Legal framework. This all regulation or irregular practice by DCI, now NDC, Consumer Protection Act, then IPC, Indian Penal Code. So, my dear friends, now there is Consumer Protection Act. This says patient is your consumer, dentist is provider, and deficiency is the case. So here patient doctors no more that bond, totally gone. So these all are consumer. If you're not providing, if you're not giving good service, they can complain. So you should, you have to answer in the court. Negligence. Failure to provide standard care. What all failure can be done, can be happen, that is misdiagnosis, improper treatment, lack of consent, post-op negligence. About consent I talked previous lecture, you can go and watch there. So negligence means not doing proper treatment. Elements of negligence: duty of care, breach of duty, damage caused. These all three elements of negligence. Then consent, I just now spoke in detail, is there in consent video, you can watch there. This is a very important informed consent where you have to explain all the risk, benefit, cost, documentation. Very important topic in for the medico legal aspects. If you not documented properly, these all three things, these all four things like case history, clinical findings, radiographs, treatment records. Otherwise, if you don't have these records with you, nobody knows when court will ask you how you provide these all things. And that is law. You should keep all the documents at least 3 years with you, either in digital format or soft copy, hard copy. However, whatever you way you can preserve these documents, you should keep with you. Nobody knows when court will ask you. Prescription, you should in prescription you must mention the correct drug and dose. Most of the people just randomly writing in the prescription is scrolling scrubbing some like something written in their prescription. Nobody knows what they written. Clearly written in the prescription, that is drug and dose. Able to read by the patient, by the chemist, or anyone. If you not written properly, you never know what happened. So avoid abbreviations. Signature and registration number must. If these all things are error, in these all things errors are there on prescription, then legal issue comes. Medical records, just now I spoke, it should be maintained 3 to 5 years. Digital records also acceptable, and you should keep confidential. They're very important. If you doesn't have indemnity insurance, my dear friends, you are in legal very risk. Your practice, yourself are on risk. My dear friends, please, if you don't have indemnity insurance, just now you take the indemnity insurance. If you don't know indemnity insurance, in few days I I give lectures on YouTube. You can go and watch there. So please, my dear friends, go and take indemnity insurance. It prevents you in further cases if happens. Nobody knows when patients complains or court will ask you to come and answer all the things. You know, court fees, how much is there? If court says you should pay to the patient compensation, from where you will pay? And compensation is not 1 lakh or 2 lakh. It comes near about 10 lakhs, 20 lakhs. Small error. Also they give this 5 to 10 lakhs compensation fee you have to pay. From where you will pay? So my dear friends, please take indemnity insurance. And how much should take indemnity insurance? We'll talk on further lecture. You can definitely watch there. Then Common cases like wrong extraction, very common nowadays because people are so hurry, so many patients are waiting. They're supposed to extract upper molar, right upper molar, they extracted left upper molar. If this case happen, definitely court will sue you. Implant failure, if you given proper communication to the patient, all risk benefits related to implant. If implant fails, they understand. If you not explain properly, if not taken consent, and if they go go into court, you have to answer. No other options. Advertising, no false claims, no guarantee of results. Follow ethical guidelines. And all things whatever given on the social medias, it should be truthful and ethical. What is ethical? That is previous lecture. Ethical also is there. Ethics in dentistry. You can go and watch there and learn. Patient rights, information. You should give inform. You should inform. You should take consents, and you should maintain its confidentiality. These all patient rights. What all dentist rights? Fees is the dentist right. Treatment can be refused by the dentist. It's dentist right. But in case of emergency, you should take up the case. You cannot refuse. Handling complaints, stay calm, communicate. My dear friends, one thing you know, any medical legal cases happen because of non because of poor communication. If your communication is good, medical legal cases not happen. Medical legal cases poor because of poor treatment not happen. It is only because of poor communication. Risk management, prevention is always best strategy. So be careful in diagnosis. Clearly mention the tooth number, what what diagnosis you have done, what all requirement are there for the treatment, any tests, any x-rays, you should mention there on the prescription. And never forget to take consent. You might think why I am given more focus on consent, because nowadays medical legal cases increasing day by day. So consent play a very important role in medical legal. So you must have consent, and consent in full details lectures are there on YouTube. You can go and watch there. Documentation, you should preserve all the document from the starting to end of the treatment, at least 3 to 5 years. In any format you can preserve, but you should have. Case scenario, wrong tooth extraction, I just explained, very common. So be careful. Ethics and law. Ethics prevent legal issues. Good ethics give you the safe practice. So, what is ethics and law? I explained in the previous class. You can go and watch there. So, whatever practice you do it good ethical way. It give you safe practice. Non-ethical way always leads to bad practice. So, be careful. So, take away message. Always do safe practice. Keep all the documents properly. If you do this too, you definitely prevent yourself from this court cases. And my dear friends, communicate properly to the patient. If your communication is good, treatment, whatever treatment you've done, but your communication and your consent, previously if you mention everything in the consent, the court cases never comes. If you not mention, suppose any cases comes to you or any patient complains to there, first understand what complaints are there. If you don't know anything regarding this, please, please take indemnity insurance. Close this video and go and take indemnity insurance. Whichever company you want, take it. If you don't know anything, you can watch indemnity insurance video. If any doubt, you just mail me or comment below the video. I will try my best to answer your questions. But today, if you don't have indemnity insurance, by the today you should have the indemnity insurance. Nobody knows tomorrow what happened. People are thinking these all were waste of money. My dear friends, 1000 or 1500 rupees is not more than 50 lakhs and 20 lakhs or 30 lakhs when you have to pay the compensation fees. And court fees, you know how much. So, my dear friends, again I advise you, take indemnity insurance for your protection. So, thank you, my dear friends. If you have any doubt, you can comment below the video. You can mail me. Thank you.